Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Welcome back to Between the Sheets. I am excited today to have Mandy Hart with us. She is a certified sexologist and the founder of Heart's Desire, an intimacy and relationship coaching. She blends behavioral science with trauma-empowered somatic methods to help people untangle the shame, connect with their bodies, and get honest about what intimacy really means for them. She's known for her mix of humor, heart, and straight talk. Mandy helps people stop performing, start feeling, and make peace with their desires, whatever they are. Her message is simple. The way you feel doesn't make you bad or broken. It just makes you human. Welcome, Mandy. Thank you so much for being here.
Thank you for having me. I'm excited and
Absolutely.
noticing that we're like kind of twinning
We
right now.
are. Yes, I love this. We have the same setup. That's so great. Well, welcome. So what kind of got you into sexology, and are you practicing and counseling right now? Kind of tell me a little bit about yourself.
Yeah, I've just had a natural curiosity about sex, I think for as long as I can remember, honestly. And I just always was sort of like the go-to person for people that had questions, my friends growing up. And my mom was an RN for a gynecologist for over 20 years. And so if I didn't know something, I'd go to her, do my homework, and it kind of took like a personal turn when I was in college, and I like found out, learned that I have genital herpes. It's type 1, and it kind of like blew my world open just educationally and information wise about like I thought I knew a lot, and then I realized there's still so much I don't know. And I really educated myself and then got kind of angry at the system for, I think, a lot of things. And then I wanted to go into sexual health education.
Yeah.
But then, and I did, I got a master's, and that was the plan. But then I realized that in the US, at least, we don't really prioritize evidence-based sexual health programming.
Yeah.
And so I threw in the towel. I was like, never mind, forget this. Like,
Yeah.
if parents are going to dictate what their kid, like, I can't go up against that. Nobody can.
Right.
That's why we keep not educating the younger generations properly. Then my course veered away from that. And then fast forward to a few years ago, post COVID, I was online. I was on Reddit. I was spending lots and lots of time answering people's questions. And then people started asking me, where can I book a session? What's your website? And I didn't have any of that. So I just thought, okay, let's make it happen. This is how it's happening.
Yeah.
And here I am.
That's awesome. That's awesome. It's really great when it comes full circle like that. And I think your story is similar to a lot of us in sex med, that we didn't necessarily go into this, but we were kind of like around it. We were the go-to for people, things like that. And then once you realize that sex med exists and the education out there is super poor and there's a lot of work to be done, all of a sudden you start finding your niche and your people find you. And it's really incredible to be in this world and helping people find what the education they were missing, and also how to just peel back the layers and
Mhm.
get to that pleasure part, because that's a big thing of
Mhm.
what's missing in the
Mhm.
education too. Is
Mhm.
sex is for procreation, sex is for partnership, but it's not we don't talk about how much pleasure should be involved and how amazing it is to have good sex.
Yeah, and with that, we're not really taught about proper communication,
Mhm.
boundaries, consent, what partnership, like what that can look like and how it can look. I mean, we don't talk about any of that
No.
stuff. We really, I mean, I don't remember talking about any of that stuff.
No, I mean, the sex that I remember in school, in grade school, and I'm in my 40s, but in grade school was, how to use a tampon, what it meant to have a period, what the
Mhm.
body parts, the anatomy that
Mhm.
we each had.
Mhm.
But that was really it. And then abstinence, right? Like it wasn't about pleasure. It wasn't about even safe sex or sex in general. It was abstinence, make a baby. That was it.
I actually have to sort of correct myself because I do remember 8th grade health ed. I do remember that we had a section on sexual health. And specifically, I remember something about like, don't let people pressure you into
Hmm.
having sex. And one of the things was the things people might say to pressure you. And
Mm,
one of them was like, if you loved me, you would.
yeah.
And then a couple years later, my boyfriend that I had when I was, in high school,
Hmm.
he actually used that line on me. And I remember being like, you're
That's
very
not right.
textbook kind of like, this is, I mean, I knew that like, there was like other stuff going on in that
Hmm.
relationship that made me, he wasn't, but I just remember being like, man, you're being so
Yeah.
cliche right now.
Right.
And I do remember learning that. So I
Yeah.
have to, my sex ed wasn't necessarily bad. It's just, it could be so much better.
Yeah. Yeah. Absolutely. So when you're working with clients right now, are you kind of in a specific area that you're focusing on, or do you kind of help everybody with whatever their sexual health need is?
Yeah, I'm open to talking about anything.
Mhm.
And there's not really anybody in particular that I would turn away unless maybe, if they didn't feel like what I was offering was a good fit. But I'm always open. And there's nothing specific in terms of like, this is what makes it so hard for me to like figure out how to reach people
Mhm.
because I don't really have a super specific demographic, but I'm targeting shame
Yeah.
and everybody carries so much
Yeah.
shame. And when they do carry so much shame, it can be hard for them to even recognize that
Mhm.
they need help in this way. So there's a big barrier to entry, I guess, when it comes to my clients, but so, like, a lot of times, it's usually people who are sort of at their desperate, like, end of the rope, sort
Yeah.
of gone through some kind of trauma, thinking about getting a divorce,
Mhm.
and they don't want to, or they're, having a hard time figuring out what that means.
Mhm.
And then just men in general. I really like working with men.
Mhm.
I love working with men and helping kind of give them an experiential practice with another woman
Mhm.
who also has like a really open mind and willingness to think about things from all perspectives.
Mhm.
And so, yeah, and then people with religious trauma specifically end up coming back to me a lot.
Mhm.
Like that seems to be one that I have found a particular gravitation towards.
Yeah. So, talk to me about the men that you're working with. What are some of the biggest themes that you see them reaching out to you for?
So a lot of times it'll start with them thinking that like their partner isn't giving them enough
Mm,
or that they're not meeting the right kind of person. And then after working with me, what I help them realize is it's not really necessarily that anybody's the problem.
mhm.
It's a matter of your expectations or maybe your internalized shame and you're like maybe projecting that
Mhm.
or it just the theme is it's always like my partner this, and then it turns into, oh, wait a minute, this isn't even about my partner at all. But I love when that shift happens because men are not really given the tools
Mm,
to like introspect and even just feel emotions.
yeah.
They don't, they're not encouraged to do that. And
Mhm,
so I I really encourage, I mean, that's like the somatic part of what I do
mhm,
is literally feel your feelings. It's kind of cliche to say that, but it's true. It's like you can actually feel your feelings in your body, let them move through you. And so many men are like, what are you talking about?
mm,
They're like, what? I'm not supposed to just sit here and be strong and not
mhm,
feeling. And like, they think that their partner is the one who's going up and down emotionally. And it's like, well, maybe you're just not expressing your emotions.
sure.
And so it feels like a roller coaster inside because you're not letting it out.
Mm.
So that's a big one. And yeah, I would say
Okay.
that's
How
a
do
big one.
you help them start to let those out so that it's not so bottled up and not so exhaustive?
So usually I would say one, I don't just like blanket statement, disclaimer, I don't like to generalize
Mhm.
ever really, but it's hard to avoid it in conversations like
Sure.
this and just in general because that's like the society we live in.
Yeah.
The gender roles and whatnot are when I generalize, I'm usually generalizing the
Mhm.
expectations of society. That
Yes.
I'm okay with generalizing. But when it comes to the individual, first, I like to make it clear through, there's like trust building and uh, got to make sure that there's trust first. And that can be really hard to establish. So
Mhm.
sometimes that's just where that can take time in itself. But yeah, so like with guys, usually it's like I can't dive right into the feeling stuff because the trust has to be there. And the trust happens with me showing them that they can tell me something
Mm.
and I'm not going to be like freaked out or think they're disgusting or think they're a pervert. I, cause it takes, if you tell me a desire and it's so off the, like it comes out of left field, I'm just like, oh, that's really interesting.
Mhm.
I'm not usually like, you're so gross,
Right. Right.
I don't usually have that reaction, and so then when people see that, that is what allows them to keep going, and so it's really like this environment of just allowing and being curious, and
Mhm.
when they feel that, it's only a matter of time before
Yeah.
the feelings start coming out.
Absolutely. Yeah, and I have found that as I work on with my own patients in my urology office,
Mm,
getting them to open up to me and tell me, a lot of them
mhm.
don't even understand the right verbiage to use
No.
because our sex ed has been so lacking. So, for example, I had a patient come in, I don't remember if it was today or yesterday, but telling me that he had erectile dysfunction when he gets great erections. What he was actually
Mhm.
complaining about was premature ejaculation. Well, that is a completely
Interesting.
different
Yeah.
issue, but
Yeah.
not everybody associates that because
Oh, yeah.
if
That
I'm
makes
not
sense.
orgasming correctly,
Right. It's a dysfunction
it's a
of my
dysfunction.
erection.
Exactly. And
Yeah.
so it's really interesting to actually like start to peel back some of these layers when I'm asking them
Mhm.
questions and getting to the root of the problem, which was
Yeah.
not necessarily what they said they were coming in for.
Yes. Exactly. I mean, that's like the perfect example of all
Mhm.
that's the case whether it's emotions, it's physical,
Yes.
it's usually both. I sometimes guys will think that they have erectile dysfunction and it's like something that needs meds because
Hmm.
that's always, I mean, it makes sense
Sure.
too. Like I get that. But then I'll learn that they wake up with
Hmm.
erections every morning,
Yep.
and I'm like,
Yeah.
"You can have erections. It's
Right.
that's the
And I
you're not
always
physically."
ask, are you able to get an erection with masturbation? Because if you
Right.
can get one
Yeah.
waking up in the morning and with
Yeah.
masturbation, you physiologically
Yeah.
are capable of your erection. So now
Exactly.
let's peel back the psychological
Yeah.
layers and
Yeah.
see where is this block coming from? And a lot of times
Yeah.
that's when I can only do so much in the urology office, but that is
Right.
when I do refer out to sexologists, sex therapists, counselors, coaches, whatever, because
Mm.
they need that time and that
Mhm.
trust and
Mhm.
relationship to be able to peel back those layers and figure out what exactly is blocking their ability. It's
Yeah.
incredible to really peel those back.
Yeah, and it's another thing that I've kind of embraced more recently is you don't even necessarily need to figure it out.
Mhm.
You just need to open the doors to
Mhm.
possibilities and kind of like take the pressure off. You don't always find the answers to these things
Mhm.
because it's usually just not that straightforward, especially when it's emotional or mental, or it it takes a lot of time before you have
Mhm.
that aha moment. And working up to it, you explore and learn things about yourself. And then that aha moment doesn't even feel as important anymore
Right.
because you're learning or, just kind of realizing that it's not this point and click or
Mhm.
sick treat. Like,
Yeah.
I have this problem. I'm going to take a pill, which again, I have no problem with that.
Right.
I'm all for if there's a problem and you could treat it, treat it.
Sure.
Just
Yeah, but it's different than when your blood pressure is too high and we know you need this medicine to get it lower. There are
yeah,
lifestyle things that we can do. We can
yeah,
sleep better, we can work out, we
yeah,
can eat a better diet
yeah,
for whatever our health issue is. We
yeah,
already know that stuff.
yeah.
So when something comes up sexually, it's not always a pill. It's almost always
Mhm.
multifactorial. And so
Yeah,
you need the layers. A lot of times, like this guy, I'll give you a little bit of ED medication to help you kind of get over this
yeah,
hump
right.
while you're doing the work to
Yeah,
get yourself better and not need the medicine,
yeah, yeah,
you know?
exactly. Yeah. Um, yeah, in some cases, I've had clients where we were able to kinda get, like, I had it was a woman, but she was able to have orgasm through masturbation, but not through partnered
Hmm.
sex, and I'm sure that there was more to it. I'm sure that her talking about it with me and just being more open kind of got the juices flowing. But I told her the way that she explained it to me, it just sounded like they were expecting it to happen really fast.
Hmm.
And she thought that the more speed, the better, I guess. I don't know. I
Yeah.
can't, this was a while ago, but I remember at one point telling her to try slowing down,
Hmm.
actually during sex,
Hmm.
like slow your movements and really focus, like really make sure that you're making like contact with
Hmm.
your bodies um and that was it. That
Yeah.
was one that unlocked it for her. And she's still a client of mine because there's more to it than just the sex. I
Sure.
do relationship stuff too, but her sex life, I
Yeah.
mean, and I was just like, "Man, that was so great." Like,
Yeah.
I can't believe it.
Yeah.
But sometimes it can be simple.
Absolutely, absolutely, and, especially for women, like, we need so much different things and friction and pressures and
Mhm.
patterns
Mhm.
and
Mhm.
velocity, all the different things, and
Mhm.
from one day to the next, you need something different,
Mhm.
so it's
Mhm.
really an exploratory thing, and I always try and, like what you said, is take that pressure off. I try and
Mhm.
tell my couples, just don't worry about whether or not you
Mhm.
orgasm every single time. Worry
Mhm.
about whether you feel pleasure because
Mhm.
where pleasure goes, orgasm will follow. If you're enjoying it, you will get there whether it's this session or next session or whatever, but the pleasure
Yeah.
is really important to follow.
Yeah, it's interesting. I just kind of thought about this as I was listening to you. I've had people say, "Well, we took the pressure off and we're still having problems." And then I think what's happening is they're actually still having expectations, maybe not necessarily for orgasm, but expectations of what sex is supposed to look
Mhm.
like. So it's like taking first, having people realize that orgasm isn't necessarily the final, like if having somebody just accept that if that doesn't happen, that's
Mhm.
okay. Or maybe, if it doesn't happen, you can masturbate
Mhm.
and still find relief.
Mhm.
But then it's like, wait a minute, you're telling me that I don't have to orgasm, and also I don't have to have sex this way.
Mhm.
And sometimes it's like, oh, I can have sex with somebody of the same gender, and I didn't realize I could do that, but I've actually been fantasizing about it since I
Mhm.
was a kid. And like, it's amazing how much people can realize once they start just giving themselves permission.
Yeah. Absolutely. Absolutely. Yeah, and I think that's giving yourself permission in a lot of different ways to feel pleasure, to explore, to do
Hmm.
things. A lot of us just feel like we give so much throughout the day that by the time there's any moment for ourselves, it's like, oh, just shower and go to bed or whatever. And it's really building in that personal time for your pleasure, sex related or
Yeah.
not. I don't care if it's
Yeah.
having your warm cup
Yeah.
of coffee in the morning with your blanket
Yeah.
and 20 minutes of reading your favorite book,
Yeah.
or if it's taking time to find pleasure physically.
Yeah.
But you have to choose that time for yourself and allow that exploration, or choose that time for yourself and also time with your partner.
Yeah. Yeah. It's okay. So like one of the things we started with was talking about this idea of how are you defining these terms? How are you defining these
Mhm,
words? And I'm huge on that. We have such a narrow idea of what sex means.
mhm,
And so then when we think of pleasure, we think, I'll just use like the obvious penis and vagina
mhm,
sex. And sex could be like, you could define it as like a moment with eye contact.
mm,
You know, like eye contact can be really intimate and sexy, and that could be a part of sex.
mhm,
It could be just cuddling. Like
mhm.
sex, there's so many ways that you can look at that. And
Yeah.
so if you start to realize that you're giving these rigid definitions to these concepts, okay, if you're talking about intercourse, sure, penis
Mhm,
and vagina, intercourse. But when we talk about sex and intimacy, we're actually talking
mhm.
about so much more than that.
Yeah.
So it's like, I like to say we all have our own dictionary and we have to learn other people's dictionaries. And then that's how we can really communicate once we understand what our dictionaries are
Mhm.
and then what someone else's dictionary is. Because we could be talking about two different things and using the same exact words.
Yeah,
Like,
that's such a great point. It really is. And because especially if you're in a relationship with someone who had a very different background from you, very different
mm-hmm,
childhood from you,
mm-hmm,
um, what we see as loving or kind, somebody else might not
mm-hmm.
be. Or, one person thinks that using terms like slut or cunt is sexy and fun, and another
Yeah,
person thinks they are
yeah,
derogatory and mean.
yeah,
And
yeah.
so it's not even always defining certain acts, it's
Right.
the emotions, which you've brought up
Yes.
before,
Yeah.
the emotions that those words or actions invoke. And whereas somebody might be really comfortable with getting a spanking and like, yeah, that's
Yeah.
great. Another
Yeah.
person is like, do not hit me. I was abused as a
Yeah.
kid. That's going to like
Yeah.
totally redline me.
Yeah. Yeah.
It's really important, I think, like you're saying, like really talk through those things and the why behind them.
Yeah, and to that point, you could also have somebody who was abused as a kid and they get turned on from being spanked. And
Sure.
then they feel maybe shameful or, like, oh, this is
Hmm.
wrong. But it's like, actually, it's fine.
Hmm.
It's if you don't like it and you don't want that, that's okay. But it's also okay to acknowledge that it turns you on. And there's actually reasons why. It's like the openness, the communication, the allowing, the willingness to explore, and all of that takes so much trust. But you
Hmm.
can't have the trust without the communication. So
Right.
there's like a little bit of like taking a leap of faith
Hmm.
too. But a lot of it is really just knowing how to find your boundaries and how to
Hmm.
find your edge. Because you might not always know what the boundary is,
Yeah.
and that's okay. But if you know how to recognize, oh, that was a boundary, I just didn't realize it,
Hmm.
then you can navigate it. So it's
Yeah.
like the tools. You need the tools to do these things. You don't necessarily need to be an expert in them.
Oh,
You just need to know how to navigate them.
right.
And that's what people just we don't learn.
Hmm. Yeah, it's a great point. And bringing up shame there, that's one of the other things that you focus on. So abuse would obviously be one of them, and kind of working through what, still lingers from that. What other areas of shame do you see in your practice?
So, this is where the religious trauma and purity culture stuff comes in.
Yeah.
And I I just posted recently a blog post. It was like the second in a three-part series about purity culture. And I do these like deep dives when I'm really trying to educate myself because I
Mhm.
didn't actually grow up with that imposed on me. And so a lot of these ideas and concepts I wasn't really familiar with. And the more I learn, the more I'm like, how was anybody ever expected to meaningful connection
Yeah.
when they've been made to feel like their bodies are dangerous if they're a man and their bodies are risky if they're a woman, like simply
Mhm.
by being in a female formed body, you're going to cause a man to sin
Mhm.
just if he looks at you. So it's your job to make sure that that doesn't happen and it's on you. And for men, not only is it like, oh, I could ruin a woman's purity and cause harm in that way, but also if I look at someone and feel things, which is a totally normal
Mhm.
thing, um, I'm gonna go to hell.
Yep.
And so it's and uh then of course you have but once you're married,
Mm.
it's your duty as
Yep.
a wife to
And
make
you better
sure
be good at it.
or you better just go along with the program,
Right.
because
Right.
I mean either way it's that's your
Yep.
job. And then for the man, it's like, he's got his needs and they need to
Mhm.
be met. And it's his wife's job to meet them. And so that creates all kinds of blurred lines. But what's interesting is this is so layered, this is so complicated because not only do you not have a chance to really learn and connect with somebody before you're in a marriage,
Mhm.
but then it's like you have these expectations of things and you're looking forward to them in a way sometimes, or there is that prospect of like, this is going to happen.
Mhm.
And it almost becomes a promise. Like, once we're married, this will happen.
Mhm.
And then when you're married, then you realize, whether it's conscious or not, that you're not actually interested in that. And
Yeah.
then, but it's just, I and, like, another thing is purity culture is not the same thing as having faith or being
Mm.
religious.
Correct.
And so I I respect people's beliefs, I respect people's faith, but I also want to empower people to think for themselves
Mhm.
and find their way by being who they are, and it's really tough.
Yeah.
It's very complicated.
Yeah, it is. I grew up in the Catholic Church, so I was very much a part of purity culture. And it's interesting when I talk with patients and I can relate to things. So, for example, I have one guy who his wife has dementia. She doesn't want to participate in sexual activities, kind of fights him off, which he doesn't pressure. Let me be
Yeah.
very clear on
Yeah.
that.
Yeah.
But
Yeah.
he was explaining to me the last few times that they did try anything, it was not a good, safe situation. And yet he wants to meet his own needs so that he doesn't look other places, things like that. And yet he has all of this guilt because he's Catholic and you're not supposed to masturbate and all these. And so it was really kind of pulling back those layers and saying, no disrespect to your religion whatsoever. You can be whatever religion you want. I fully support that. But let's look at this from a biological scientific
Yeah.
standard instead of that. There's nothing inherently good or bad about masturbating.
Mm.
And there are very good and beneficial health benefits from regular
Mhm.
ejaculation and getting
Mhm.
regular erections and things like that. And so
Mhm.
we kind of talked through doing like a penile exercise program and reframing it in that sense,
Okay.
and that really helped him, like, just agree to it. Like, okay, this is
Yeah.
healthy for me. This is something that I'm going to do. Just like I go for a walk every day for my heart, I'm going to get 2 to 3 erections a week
Yeah.
because that's good for my penis.
Yeah. Yeah. Something I've been hearing more and more is this idea that if you can abstain from masturbating, it's healthier and better for your masculinity. And there's a lot of things around that. And I was like, wait, what? Don't
Yeah.
we know? Wait, huh? And and people say it as if it's fact. And I'm like, I don't even know where to start with that because, again, masculinity is a concept, but also we know that ejaculating for a man is healthy.
Mhm.
And then if you have somebody who says, well, that's like the science is fake or not real,
Mhm.
then, they're just not willing to accept the evidence based information.
Do you deal with any patients who have had sexual abuse, been raped, something to that degree that are
Oh,
trying
yeah.
to work through that shame?
Yeah.
That which is
Yeah.
not they should not feel shame, right?
Yeah.
Like, let's get
Yeah.
that out
Yeah.
there. It's not your
Yeah.
fault. It's not
Yeah.
but a lot of people who have experienced those, I have found in my practice that there's a lot of shame around admitting
Mhm.
it, around the fact that
Mhm.
they were quote unquote
Mhm.
participated
Yeah.
in it.
Yeah.
So
Yeah.
how do you help people with that?
So again, it's tough, especially when you're up against cultural beliefs, which I see a lot and so much on both sides
Mhm.
too. Like I've talked to men who have realized that they were engaging in sexual acts that weren't consensual,
Mhm.
but they genuinely didn't realize because it's like this is real where people think if a woman is lubricating that she wants it. And if you really have that belief, you really believe that, then yeah, you're going to think that's consent and it's
Mhm.
not. And it's
Right.
very dangerous. And so that's one thing. But then talking to people who have endured abuse,
Mhm.
whether it was recent and they think they didn't do enough and maybe sometimes even they've tried to report it and the police made them feel as if you didn't fight then was
Right.
it really rape? There's all these like undertones of
Mhm.
this expectation that if you don't want it that you're going to say no and you're going to fight and that's just not always true.
Yeah.
But that's a whole different thing. Like law enforcement, again, it's lack of resources, lack of education, lack of information, because they're just not trained to have this particular kind of sensitivity,
Mhm.
not even trauma empowered, but trauma informed. What's really what a huge breakthrough for a client of mine and me as a coach to watch her
Mhm.
was she had struggled for so long. She was raised Catholic and didn't really engage sexually until college years.
Mhm.
And one of her first real situations with a guy turned into, I mean, it was an assault. And for so long, she blamed herself and felt guilty, felt shameful. And she was looking to forgive herself. And it was through this very powerful session that I don't think I'm ever going to forget because of how amazing it was to watch this. And we had worked together for a while. So
Mhm.
there was so much trust. There was
Yeah.
so much understanding each other's dictionaries. Like
Right.
we had done a lot of work together. And what ended up happening was she realized she couldn't forgive herself because there was nothing to forgive because she
Mm.
didn't do anything wrong.
Yeah.
And that's like an example of like you're chasing the wrong thing or not the
Yeah.
wrong, it's like it's not the aligned
Mm.
thing. She was never going to learn how to forgive herself because she honestly had nothing to forgive. And when she realized that, it was as if she was letting go of a
Mm.
200-pound weight. I mean,
That's amazing.
it was incredible.
Yeah.
So it's like you can work with somebody and try to help them forgive themselves,
Mhm.
but
Yeah.
like what what message does that send?
Right.
It's one thing to hear a client try to meet them where they are, but then you got to like really figure out what it is that they're actually
Mhm.
saying. And that's often not, or like what it is that they really mean, because it's
Mhm.
often not what they're saying,
Right. Right.
which is pretty full circle.
Yeah, and like you said, that takes time. When I have a
Mhm.
patient come in and we get 10 minutes together,
Yeah.
I'm not gonna pull through that probably in several meetings with them, all of
Yeah.
which are about 10 minutes.
Yeah. Yeah.
This is why I find what you do and what other sex coaches and counselors and therapists do to be so vital, because those of us that do the medical side of it for the ED treatment, the orgasm treatment, things like that, I don't have the time clinically to help you peel back the layers.
Yeah.
And, just today I had a young 30-year-old guy come in with new onset of ED in the last couple of months. He's not on any medications. He wakes up with erections.
Mm.
We talked about his porn use. We talked about cutting back on that.
Mhm.
We talked about his relationship a little bit. And then my time is up. And
Yeah.
so
Yeah.
then I say, okay, here's a couple people that are in my book that I trust. And,
Mhm.
here's a male, a female, whatever, so that you can
Mhm.
find who works
Mhm.
best for you, is in your price range, all of those things,
Yeah.
because there is so much more work to be done here than what I
Yeah.
can give you.
Yeah. Yeah. It's really something you need to kind of tackle from all angles because our sexuality is so core and
Mhm,
it's also very often so compartmentalized
mhm.
that it's like you've got to look at it from all angles in order to
Yeah,
be able to get to it because it's really hidden deeply protected inside somewhere.
yeah.
And it's like you gotta it's not that straight line, easy
Mhm.
answer. And it's interesting, the person I was just talking about who, realized that she didn't need to forgive herself, she identified as somebody struggling with vaginismus. And after a while, I realized that she doesn't have vaginismus
Mhm.
at all, really. I mean, I don't think it can be it's vulvodynia,
Yeah,
and
which is
it's
pain with sex.
yeah,
Yeah.
it's and for her, it's I've also done a lot of research on this and a lot of reading and deep dives, but it's oh my gosh, why am I blanking? At the, entry, the vestibule
Sure, at the opening
vestib
of the
yeah, it's specifically pain with it's, like, not specifically
Mhm.
penetration. So I don't think I can't remember, but I don't think that's technically vaginismus.
So, vaginismus is a kind of a blanket term for what we use for it can be
Mm,
cramping in the pelvic area, it can be pain with penetration, it can be pain with sitting in certain positions, different. There are a lot of different cause or triggers for vaginismus, but at the most basic form of it is it's pain in your perineal area that is uncontrolled and not necessarily truly identifiable as to what the cause. But a lot of
mhm.
times we're finding, and I think this is where you're going with it, is we're finding it's from trauma and it's emotional pain more than anything.
Yeah, I mean, it's tough. It's so tough because it's not necessarily trauma. There's also physiologic causes, and
Sure.
then you can have a blend.
So one of them is definitely, we are learning that there's a lot of emotions carried in your pelvis, that your pelvis remembers a lot of pain and trauma. And so sending people to therapy to work through the mental aspects of it, the psychological aspect of it. I send patients to pelvic floor physical therapy to work through, overly tight muscles to loose ligaments, different things like that. Sometimes we need to do a little bit of a vaginal suppository with some Valium in it just to kind of calm down the spasms. There's a
Yeah.
lot of different ways, because there's a lot of different ways that people experience vaginismus. And so it's
Yeah.
not a one size fits all diagnosis. It's
Yeah.
very, very individualized in the care. But you're right, it's difficult for us to peel back all those layers in a quick 10 to 15-minute appointment. And so you do have to give out these referrals to get other people on board and treat it from a holistic perspective, because it is multifactorial. There's not just one stop shop. Here you go. Now you're good to go.
Things and yeah, and it can be so hard too to have a bedside manner that really speaks to the person
Mhm.
because if you have what is perceived as like a defeatist
Mm.
attitude, then it can feel to the patient like you never had hope for them anyways,
Right.
But it's like often that the first thing you try isn't going to
Mhm.
work. So
Yeah.
It's tough.
Yeah,
I
that's one you pretty much just throw the whole kitchen and the kitchen sink at and just give different tries on things. So
Yeah.
I so appreciate this conversation. I want people to be able to find you and get in touch. So take a minute here and plug yourself and how people can get in touch with you.
So, if you want to just follow me and learn from what I have to say, you can subscribe to my blog or you can follow me on Instagram. My blog you can find on my website, which is hearts-desire.com. Hearts is spelled Harts. And you can find me on Instagram at hearts.desire.coaching. And also, I started a new page, Mandy Hart coach. So I'm like shadow banned, so that's a little
Yeah,
harder. So
most of us in this genre
uh-huh.
are.
Yeah. Yeah. But if you go on my website, there's a contact page. My email's there. You can email me or you can just set up a free discovery call right on my website. So the
Awesome.
scheduling tab, scroll down, my calendar is there. If you want to just skip all of it and meet me face to face for free, nothing to lose, just schedule a
Perfect.
call.
That's
Yeah.
awesome. That's awesome. And I will put the links and such in the show notes as well so people can get in touch with you. Thank you again so much for being here. What a great
Thank you.
conversation. I appreciate
Yeah.
everybody listening and have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.